Hi, Mom, seriously, I'm trying to make a video. Can you give me 1 minute? Let's try this again. Hi, and welcome to the Spring Hill Equine Seminar. If you're new, like me, don't worry, it's gonna be fun. We'll give everyone a chance to grab some food and get comfy, and then we'll get started. Mom, I'm working here. You're always embarrassing me. Okay, I think we're about ready to go.
Hello everybody, welcome to the Spring Hill Equine Seminar. Tonight we're going to do canine respiratory disease, an update. Just first to check if you can put in the comments if you guys can hear me okay. We want to make sure our audio is working well. I am Dr. Sarah Beth Swizak, for those of you that knows, along with our most beloved horses. So we're talking today about when dogs are coughing. And some of you may have heard about some big respiratory disease outbreaks in the news concerning dogs. And so we're just going to kind of chat about that today and give you an update on what to do, how to plan, and how to keep your dogs nice and safe. All right, so you guys have probably seen some things in the news at the end of last year, kind of between August and December. There was this mystery dog illness going around. People were talking all about it. We talked about dogs getting really sick, some dogs even passing away from this sort of mystery disease. It made the news everywhere. This is a map of the states where this sort of uptick of respiratory disease cases were found. And so you can see Florida was included on that list. Again, this is kind of the end of last year, but there's still some people kind of concerned about what's going on with this sort of mystery disease. And we were seeing more and more dogs kind of get sick with respiratory illness. And it sounded like from a lot of the news articles that veterinarians didn't always know what to do about it, and dogs weren't always responding to treatment. So people were wondering, what do I do to keep my dog safe? Do I have to put a mask on my dog? People stop taking their dog to boarding kennels and parks, and even sometimes stop taking them to the vet because they were scared of, getting their dog sick with other dogs. So let's kind of chat about that. So kennel cough, right? Everybody talks about kennel cough. We have a kennel cough vaccine. We talk about dogs getting kennel cough, and we think of it as kind of just this thing that dogs get. We think of it as one disease, one problem. We think that they get it from the kennel. That's what's in the name, right? They get it from a boarding kennel, and that we do the vaccine for it, and that's supposed to stop them from getting it. Well, the truth is that kennel cough is just the layman's term for the big, long title of canine infectious respiratory disease complex. The complex there is the important part. It means that it's a little bit complicated. So what this is a syndrome of diseases. It's actually caused and can be caused by a couple of different viruses, a couple of different bacteria, and we usually have kind of mixed or co-infections. For those of you who have large animals, if you're familiar with shipping fever in horses or in cattle, it's actually very, very similar. It works quite the same way, where we typically will have a virus that initially kind of starts things going that they pick up from another animal, or something like a fomite, which is something that transfers disease. So like your shoes can be a fomite, brushes can be a fomite, dog leashes can be a fomite, any of those things. can transfer viral particles. A dog, a cow, a horse picks up those viral particles, gets infected, and then the bacteria that either already live in their respiratory tract, we'll talk about that, or other bacteria that are kind of out in the environment take over, and they sort of take advantage of the virus weakening the immune system. And so because of that, each one of those bugs usually can't do a whole lot of harm by itself, but when we combine them, with their powers combined, they can make our animals pretty sick. So we'll talk about kind of some of the players in this complex and kind of talk about what they mean. So the first one is parainfluenza, and that is a viral disease. It is included in our core distemper parvo vaccines, and we'll kind of talk about vaccines a little bit later. But this virus, with the latest research, it actually probably plays a pretty big role in a lot of these infectious disease complexes. And spoiler alert, it probably had a lot to do with the uptick in cases that was going on in the end of 2023. The issue with parainfluenza is that its shedding period, meaning the period that the animal is sort of releasing it into the environment, is really, really short. It's only about 3 to 5 days. And they actually don't always get sick until after that 3 to 5 day mark. So if they're not shedding the virus, when we do our diagnostics and kind of look for that virus in their respiratory tract, we can't find it. We can only find it if they're shedding it and if it's living up there. So we don't often diagnose parainfluenza, even when we do kind of our more advanced diagnostics, because it only hangs around for a little bit, causes its trouble, and then it runs away. But it probably plays a pretty big role, so we want to make sure that we're vaccinating for it. Bordetella, this is the infamous kennel cough. This is what everybody thinks of as kennel cough because it's the main ingredient in most kennel cough vaccines. They're actually Bordetella vaccines. Bordetella bronchoseptica is the sort of big fancy term for that, and that is actually a bacteria. It's a bacterial pathogen, and it can live in the environment for a little while. It can be spread from dog to dog. What we always say is if dogs have nose-to-nose contact with other dogs, they need to be protected definitely from Bordetella and definitely from parainfluenza as well. And so, like we said, the kennel cough vaccine isn't just for dogs that go to a kennel specifically. It's for dogs that see other dogs, which is most of them, right? So if you're going to a dog park, if you're going to a dog beach, if your dog is coming to work with you and maybe other dogs come and visit, or even if your dog, goes for walks and romps around the neighborhood and meets your neighbors and meets your neighbors' dogs, these diseases can certainly impact them, and we want to make sure we're protecting them. Influenza, this is kind of similar to the human flu, so to, human influenza. This was also in the news and made a lot of dogs sick. A couple of years ago, I want to say it was 2016, 2017, a new strain of influenza came around the country and started really making a lot of dogs sick. Influenza, when this is a player in this infectious respiratory disease complex, it can make dogs really, really sick. It tends to move from the upper airways, where some of the others like to stay, down into the lungs, and we get into true pneumonias that really require a lot of dedicated treatment. There are two strains of canine influenza. There's H3N8 and H3N2. H3N8 is a little bit more historic. It's been around in the country for a long time. The thought is that that strain isn't around a whole lot anymore. We really haven't diagnosed that strain in about 3 years, whereas H3N2 is the newer strain that came about, like I said, a couple of years ago, but that's the one that's definitely still circulating. And again, there is a vaccine for canine influenza, so definitely recommend, if your dogs are around other dogs, that we get that vaccine on board, because there's a good chance, that vaccine isn't super common. It's not considered a core vaccine in a lot of areas. So there's a good chance as well that influenza had a big role to play in this sort of uptick in respiratory diseases in 2023. Mycoplasma. Anyone who's ever heard about mycoplasma knows that they are very annoying little buggers. They're hard to kill. They're hard to get to respond to antibiotics. They like to live in the environment for a really long time. They're really, really tough to deal with as a species. And so what we know about mycoplasma in the dog is that mycoplasma organisms live in the dog respiratory tract all the time, every day. Your dog at home, I promise you, it has mycoplasma living in its nose, hanging out. So most of the time, it's no big deal. It lives up there, it hangs out. What seems to be the issue with mycoplasma is they're little opportunists. And so when a virus comes along or a bacteria comes along that tries to weaken your dog's immune system, the mycoplasma sort of rides the little escalator down to the lungs, and it's not supposed to live in the lungs. It's only supposed to live up in the nose. So when it goes down into the lungs, it causes a ton of inflammation, and it causes crazy coughing, crazy mucus down there, and it can make them really, really sick. So unfortunately, there's not a vaccine for mycoplasma because we know it lives there, and it's going to be in the dog all the time. But the issue is that it takes advantage when the others get on board. Streptococcus. This one is a little bit weird. So Streptococcus is a type of bacteria. For those of you who have horses, you're probably familiar with Streptococcus. We've got Strep Zo, which is kind of a common bacteria we worry about in horses. And then we've got the dreaded Strep equi, which is our strangles bacteria. We never want to hear about that one in horses. So Strep Zo, while it's relatively common in horses, can sometimes infect our dogs. And interestingly, it almost is never from a horse, so you don't have to worry about your horses getting your dogs sick. But when dogs do get infected with Strep Zo, they get incredibly sick, actually. Strep Zo is really, really, really dangerous for dogs, but it almost always happens in really crowded, like shelter type situations, and that's where it kind of runs through a population. So for your normal kind of house dog, it's not something you super have to worry about. But again, it's a part of this complex, and certainly if it got involved, all of these other things would kind of use their opportunity to help out and make your dog really sick. Canine respiratory coronavirus, going to put it right out there, has nothing to do with the human coronavirus. It's a totally different organism. It's not related to COVID at all. But it is respiratory coronavirus. This one probably respiratory disease complex cases. So this one's a pretty mostly be making sure that we're up to date on all of our vaccines. Canine pneumovirus, this one's pretty rare. Again, this is mostly a shelter dog type issue. So when we've got large groups of dogs that might not be vaccinated together, then this pneumovirus. So like I've said a couple of times, you may have gotten the hint that I would recommend vaccinating your dogs. So a couple of different vaccines to talk about. This is kind of what we call the distemper vaccine, but it's more than just distemper. It's going to have the adenovirus, it's going to have the parainfluenza, which we talked about, and then of course parvovirus. Distemper and parvo we're not talking about today. They're not respiratory diseases, but they are very important diseases that you want to make sure your dog is always vaccinated against, as well as making sure puppies are always vaccinated against that. And then we've got our Bordetella or kennel cough vaccine. Now the big deal here, we talk about this as a Bordetella vaccine, but if you can see in this vaccine box that I'm showing here, we've also got parainfluenza in the Bordetella vaccine. Now this is super important because this vaccine is what we call a mucosal vaccine, meaning we don't inject it like we do a bunch of other vaccines. We put it on the mucosa or the moist parts of the respiratory tract. That can either be the nose or the mouth. At the clinic, we use the nasal vaccines because they've got a little bit better efficacy. And so what we're actually doing when we do those nasal vaccines is we are directly stimulating something called the mucosal immune system. So dogs actually kind of have their own little separate, kind of frontline team to hold off pathogens at the gate in their mucosal barriers. So their nose, their mouth, the back of their throat. And so we are directly stimulating those guys so that we can keep away those viruses and bacteria kind of at the front door. We don't let them in. And what we've learned in the last couple of years is that specifically the parainfluenza component of this, which like we talked about is probably really important in these respiratory disease complexes, we get the very best protection from it using mucosal vaccines. So yes, it's included in our injectable vaccine, but we can't always rely on that protection. We really need the mucosal vaccine protection for that one. And then finally, like we talked about, the canine influenza vaccine. That one, like I said, is a little bit newer on the market. You will find both bivalent, meaning both strains, and single valent vaccines. And the big thing is, if you're doing a single valent vaccine, you want to make sure that it's the H3N2, because that's the one that's kind of going around and has been going around for a couple of years. The bivalent vaccine is probably very helpful because you're making sure that you're protecting against both, just in case that H3N8 kind of rears its head again. So this is actually what kennel cough is the last 5 minutes of me chatting to you. This is what kennel cough is. It's not one disease, it's not one bacteria, it's this whole combination of things. And what we learned after all of these news stories about mystery illnesses and respiratory things is that most likely, based on what we've all seen, is that this was just a relatively normal uptick in all of these respiratory complexes, and it probably had all of these players. And so it wasn't necessarily one new bug, it was a bunch of old bugs that were all rearing their ugly heads. So, but why? Why did that happen? You know, it was definitely big news, and there was definitely lots of veterinarians, lots of really smart people saying, this is more than we normally see. You know, we know what we see this time of year, and this is more. So why do we think that happened? More dogs. So we all know that COVID just happened, is still going on very much. But during the sort of pandemic where everybody was sheltered at home, 23 million Americans adopted a pet during that time. We all wanted, you know, friends while we hung out at home and learned what TikTok was, you know, so we all adopted lots and lots of pets. So we've got more dogs in the household, more, you know, animals around. We had disrupted veterinary care. You know, certainly as veterinarians, we tried to continue care as much as possible, but you all remember curbside type services where we were trying to protect the humans as well as the animals. And so we couldn't have, you know, dogs and cats coming into buildings, and we had to do this curbside service. We were super busy, and it was really hard to get veterinary care. And, you know, if you were someone who either had COVID or was at really high risk of COVID, you didn't want to bring your dog out, you know, to the sort of outside world, to the veterinarian, which is totally understandable. So we had that disrupted veterinary care not that long ago, for a lot of our dogs. We've had changes in sort of human activities. So a lot more people work from home now. People have more sort of hybrid work schedules. And you'd think that means the dogs are maybe safer because they're hanging out at home. But what we've actually found is that there's a correlation where, because people are working from home more, their dogs are staying at home with them, those dogs aren't necessarily getting vaccinated for things like Bordetella, things like influenza, because daycares and boarding facilities are the ones that require those vaccines. So if the dog isn't going to a daycare, it's not necessarily getting vaccinated if its owner doesn't know that we need to do that. But that dog is still seeing other dogs. You know, most dog parks don't have a vaccine requirement, and you don't necessarily know what other dogs have at the dog park and whether they've been vaccinated. Playing with their neighborhood dogs, or they're going to dog parks, and they may be around dogs that aren't protected, and they may not be protected as well. So they're more likely to kind of get that disease. And then frequency of vaccination. So like I said, we're potentially vaccinating our dogs less over the last few years. And that doesn't always cause an issue immediately. You know, when you skip a vaccine and you're a month overdue, at least in dogs, it doesn't always immediately cause an issue. And so we're sort of hitting that period where it's going to really start causing issues for those dogs that haven't been up to date on vaccines consistently for a couple of years. And so what that does ultimately is it decreases what's called the herd immunity or population immunity. I think you all probably remember those terms from when the COVID vaccine came out, that we want a high enough percentage of the population vaccinated for a disease to keep the spread of it very low. So with dogs, we know that the percent of them that are vaccinated has gone down, so that's also decreased our population immunity. So as before we said, it's party time for the bugs. So all of those aspects of the respiratory disease complex have been increasing in our dog population because of all of these factors. So what is this crazy disease, right? What is infectious respiratory disease complex? Now we know it's not this new mystery illness. It's not something that we can't protect our dogs from. It's a disease and a complex that's been around for a really long time. And so we want to know how to recognize it so that we can protect our dogs. And if we do have a sick dog, we can help them. So these are some of the things that we may see. Cough is a big one. Cough is always a reason to call your veterinarian and talk to your veterinarian. There are a lot of different causes for cough. It's not always infectious, but it is a very important clinical sign that we want to pay attention to. We don't want to ignore our dog that's starting to cough and continuing to cough. A wheeze, that is also always a bad sign. That means that they can't move air through their lungs very well. For those of you who have horses, if you have an asthmatic horse or a horse with inflammatory airway disease, those horses wheeze, and you all know the heave line that they get because they have to work really hard to breathe. That's exactly what your dog is having to do if you're hearing a wheeze from them. They're working really hard to breathe, and it can be really problematic for them. Fever, you may not realize this at home. You probably won't be taking your dog's temperature at home, but a fever can certainly cause them to be lethargic, not want to eat, and just generally not feel very good. Sometimes they will feel warm as well, although that's not something we can rely on. It is an old wives' tale that the temperature of their nose has anything to do with their health, by the way, so don't worry about checking that. And then sneezing, certainly dogs sneeze every once in a while, and that's totally normal. I sneeze every once in a while, and that doesn't mean that I have COVID. But sneezing continuously, and especially if we're seeing colorful discharge from their nose, so green or yellow discharge rather than just kind of a clear liquidy sneeze, is definitely an indication that we've got something going on. Now, these last three are the big deals, right? So purple or blue gums, that indicates something called cyanosis. And what that means is there's not enough oxygen running through that dog's body because they can't take enough oxygen in because their lungs aren't working. And so if you ever see that, no matter what, that is always a trip to an emergency veterinarian because that dog needs to be put on oxygen for sure. And then lethargy and inappetence we've kind of talked about. So your dog's just a little bit lazy, not wanting to get up and play and do all their normal things, not wanting to eat. All of those things kind of point to a dog that doesn't feel super good. We can't ask them where it hurts, right? We can't ask them what's going on. So we've got to be really good detectives and pay attention to what they're showing us and what they're telling us. And you as their owner, you're the best person to do that. You know your dog the best. And if they're not acting like themselves, that's a reason to get them checked out. And the really important thing is if you see these things, when you call and you say, hey, I think my dog needs to see their doctor, you do need to tell our office staff when you make that call that you've got these signs going on. Don't just say my dog's sick. Say my dog's coughing, my dog's sneezing, my dog wheezed and I was worried about it. Because we're going to treat your dog differently, meaning that we are going to potentially have them come in through a different entrance. We're really, really careful with them. So we want to make sure that we're treating them. So diagnosing canine infectious respiratory disease gets a little bit complicated. We're not going to go into a whole lot of detail, but a lot of it is honestly the dog parks, have they gone to a boarding kennel? Have they gone to a daycare? And then obviously what their vaccine history is. And so we're going to use kind of their clinical signs and their history. Obviously, if they've got a fever, we're going to be really worried. And then if we want to kind of do some more advanced diagnostics to try to get a real answer, we're going to do what's called PCR testing. And so we're going to do, it's a lot like a COVID test, we're going to do a nasal swab on the dog. Sometimes we'll do a swab in the back of their throat, or we'll do a swab actually in their lower eyelid. All three of those places are areas where those infectious respiratory disease bugs can hang out. And so we'll do those swabs, we'll send them off to a lab, and they will test for essentially all of the bugs that we talked about in the earlier slide, and they'll tell us what they found. Now remember, not all of those bugs are shedding all of the time. So we don't always necessarily get the answer that's causing the dog's issue, and we've got bugs that live there all the time. So when we find mycoplasma, especially in the upper airway, we actually don't worry about it because it's supposed to live there. But if we were to do a lavage of their lungs and pull up mucus from their lungs and send that off and find mycoplasma, that's a really big deal. So we always have to interpret these diagnostics and compare it to our clinical signs and what our dog is doing. So what do we do? How do we stop this? How do we prevent this? How do we treat this? So vaccinating is really the answer here. Certainly being careful with what dogs your dogs are around, knowing the vaccination history of other dogs, but is important, but making sure your dogs are up to date is the very best way to protect them from these respiratory diseases. So what that looks like for the most part, and this is a general recommendation, you're going to want to get specific recommendations from your veterinarian. If that's me, Colin, we'll chat about it. If it's a different veterinarian because you don't live in Florida, then talk to your regular veterinarian and get an individual vaccine plan for your individual dog. But in general, all dogs should get the distemper combo vaccine. We talked about that a little bit earlier. It's got multiple diseases in it that we're protecting against. So it's got that distemper and parvo that are super important. It's got the adenovirus that is also important but isn't really a respiratory bug. And it's got the parainfluenza. And we do want to cover for that using an injectable vaccine, even though we're going to also cover for it using a mucosal vaccine. And the general sort of plan for distemper combo vaccines is that when we have puppies, young puppies, we are going to booster them. We're going to give them a vaccine every couple of weeks in their young life until they're about 20 to 24 weeks of age. So you're going to see the vet a lot. You're going to come in every 3 to 4 weeks. We're going to give that booster vaccine. And then at that last puppy vaccine, we're going to call that vaccine good for 1 year. So we're going to have them come back 1 year after their last puppy vaccine. Usually they're also getting a rabies vaccine at the same time, and that one's also good for a year. So it makes sense. They come back in a year for kind of their annual shots. And then in dogs, we're very lucky that they can actually hold on to vaccine immunity a lot longer than some other species, horses, can. And so the distemper combo vaccine in adult dogs can actually last for 3 years at a time. So then we only have to do it every 3 years, which is great because it means that you don't have to get that poke every single year. That doesn't mean you don't have to go to the vet though. You still have to go to the vet every year for your annuals and get your checkup and all those things. And if you've got that good relationship with your veterinarian, they will keep track of that vaccine for you and make sure that you know when you've got to come in for that distemper parvo vaccine for your dog. And then dogs that have any contact with other dogs. Remember, that's not just going to a boarding kennel, that's seeing any other dogs. We should do the Bordetella or kennel cough mucosal vaccine. Try to make sure it includes the parainfluenza as well. You can certainly ask your veterinarian and make sure that they're purchasing a vaccine that includes that. And then you should get the canine influenza shot for sure. And both of those vaccines are every year. Those don't last for longer than a year. So that's a good reason to make sure you come to your annual checkups at the vet and keep those vaccines up to date every single year. So that is the very best way to prevent. Not going to go into treatment in this chat because it's going to really depend on kind of what your dog is doing and how sick they are if they come down with this infectious respiratory complex. I will tell you that we don't always use antibiotics because we don't always have a strong bacterial component. And so a lot of times it is kind of, again, like COVID a little bit, where it's a virus and we've got to kind of just let them fight off the virus, especially if they're not super, super sick. But if they are super, super sick, then it can go all the way up to needing IV antibiotic type medications, IV fluids, sometimes even hospitalization in an oxygen cage. So it's much easier to do your regular vaccines and prevent against this disease than to have to deal with figuring out what kind of treatment to do. So that is my little spiel, my little update on canine infectious respiratory disease complex. I can definitely take any questions. And just a reminder, we don't have a date yet, but our plan in February is to talk about training your horse for vet visits. So I'll take any questions, just throw them down in the comments.
You said that the temperature of the nose doesn't really mean anything, but does it matter if it's wet or dry?
Great question. So the question is, I said that the temperature of the nose doesn't really mean anything, but does it matter if the nose is wet or dry? Not really, is the short answer. Usually dogs with wet noses lick their noses a lot, and dogs with dry noses don't lick their noses a lot. That's kind of the usual answer for that. Now, if your dog has a particularly crusty nose, especially if it has discoloration, like little brown sort of crusts around the edges, That can sometimes be something that you want to check out with your veterinarian. It's not usually a sign of respiratory disease, but there are some other things that can want us to kind of check that out. Usually things that connect up to the eyes and have to do with dryness. So there are some things you want to pay attention to in your dog's nose for sure, but whether it's wet or dry and whether it's cold or warm aren't actually really indicators of health.
If your dog has had one of these bugs, does it make it more susceptible to it in the future?
That's a really good question. So if your dog has had one of these bugs before, does it make it more susceptible to it in the future? That's a really good question. The annoying answer is it depends. Certainly, if one of these bugs makes your dog severely ill, especially if it gets down into the lungs and leads to what we call pneumonia or infection of the lungs, that does often leave some degree of permanent damage. Now, that doesn't mean that your dog is going to have trouble breathing for the rest of their lives. Usually they're going to go back to acting like themselves once they've kind of overcome that disease and gone through their treatment. But at a microscopic level, there is usually some at least semi-permanent to permanent damage to their lungs. And so there is some thought that that could predispose them to infection in the future if another bug gets down in there. But in general, the kind of upper respiratory type things aren't going to necessarily make them more susceptible once they're over that bug. So while they're still sick with it, yes, they're certainly susceptible to other bugs. But once they're kind of treated for it and are feeling back to themselves and aren't coughing or sneezing or anything anymore, they're not necessarily more susceptible to it. I will say dogs that are significantly susceptible to all of these respiratory things are brachiocephalic dogs, and that means squishy face dogs. So bulldogs, Boston Terriers, Shar-Peis, anything with kind of a smushed face. Those dogs are extra susceptible to respiratory disease, partially because their nasal passages are abnormal. They're not shaped the way that they really should be, and because they already have trouble breathing. And so when you add in respiratory disease, it makes them a lot sicker.
Is there anything that we have to worry about our dogs sharing with our cats?
Is there anything that we have to worry about our dogs sharing with our cats? None of the bugs that we talked about. I can't promise you that there's not a single, virus out there that a dog couldn't share with a cat, but all of the infectious respiratory disease complex bugs that we talked about today, those can't get shared to cats, and generally none of those can come to humans either. All right, sounds like that's all of our questions. Thank you guys so much for tuning in. Feel free to leave more questions in the comments. If you guys are watching this after the fact, throw your questions down there and we will reply to you in the comments and get you an answer. Thank you guys so much for tuning in.